Welcome. This is the webinar, A COVID Year in Review, What We've Learned About Partnerships Across the Continuum. We're so glad that you're able to join us. And we want to thank those of you that shared with us as you registered the questions that were on your mind. We tried to frame this conversation and respond to as many of those questions as we could in the sharing of the content. I'm Mary Minetti, and I will be moderating today's conversation, but I'm joined also by my colleagues, Marie Abraham, who's the chat monitor, and Natasha Reed, who is going to provide us with all the technical support that we might need. Just want to remind everyone that you've all been muted upon entering. We're asking you to use the chat box for all questions and comments. We've got a lot of content in this hour. We will probably not have time for a live Q&A, but we will be responding to the questions as we go through the content during today's presentation. We will be providing a recording of the presentation and all the handouts on our website, but for those of you that have registered, you will also be receiving that information and those links right into your inbox. If you have any technical difficulties, please reach out to Natasha, as she will be able to help you problem solve those. I want to start by thanking the New York State Health Foundation, who has really supported the Institute for Patient and Family-Centered Care in providing a resource and a clearinghouse for up-to-date and accessible information about what's happening in the world of partnerships during COVID-19. We've held a number of informal conversations where we network and learn together, as well as a number of webinars, and that's all available on our website. And this work would not be possible without their support. Today, we're really going to focus on some tools that have been developed as a result of the work that's been done in the conversations that we've held over this last year. We're going to highlight for you some partnerships, some spotlights, some promising practices that we believe are possible for anyone who's interested in maintaining and advancing patient and family-centered care. When the Institute for Patient and Family-Centered Care has been advancing the practice of working in partnership with patients and families and residents for over 27 years. And when the pandemic hit and so many things kind of got upended, including partnerships with patients and families during that very unsettling time at the very beginning of the pandemic when so much was unknown, we wanted to think about how to be reminded about how important patient and family-centered care was. And so we began to use the metaphor of the North Star that we really needed to help utilize the concepts of patient and family-centered care to ground us and to help inform decision-making and practices in a variety of healthcare settings as we were navigating a situation that we'd never been in before. I want to acknowledge that this has been a hard year for everyone. It's taking its toll on healthcare workers who've been surveyed and are reporting that they're feeling burned out and overwhelmed and not supported as much as they need. There have been a number of surveys related to how adults that aren't healthcare workers are managing, and 41% of adults are feeling anxious and depressed in a recent Kaiser survey. Overall, COVID-19 is creating suffering and mental health issues for children and adolescents. So depression and anxiety is kind of rampant across the age groups and the different individuals. And so we need to be mindful of that. And I want to acknowledge and thank all of you for doing the work that you're doing. How we get through this and how we've gotten through it to date is recognizing that we're doing the best that we can, and we're continuing to learn about partnerships and how we can really strengthen those. And we've got some great examples that we'll be sharing with you. It's important to stay connected. And so thankfully there's hope, and we are going to be continuing to connect with people and just be reminded of how important relationships are. I want to go ahead and turn it over to my colleague Bev Johnson, who's going to share with you a new tool that we've created that we're very excited about. Bev?
Thank you, Mary. And I appreciate your setting this up. In preparing for today's webinar, I thought back to it was almost exactly a year ago that we were working together to prepare and present our first webinar on COVID-19 pandemic issues. And so many people on the call today were helpful to us at that time. And what was so enormous was in just a few weeks, hospitals and health systems all across North America had really gone into lockdown and almost immediately said there could be no, quote, visitors allowed in hospitals. We naturally were very concerned about that, very concerned about the pandemic, but began to think then about how can we move forward and use the evidence to safely include families. We had a wonderful team to start this work. Deborah Dokken, many of you know, is a family leader, and she's the IPFCC coordinator for patient and family partnerships. And she was the lead writer in developing this. And in the process of preparing that initial COVID webinar, we met Hazel Markwell. Hazel is just a thoughtful, extraordinary ethicist who has worked all across Canada. And she had written a paper in 2004 that articulated the concerns about the way we handled family presence during SARS, and that we really needed to listen to that. And subsequently, IPFCC published several papers on that same topic, but we still didn't learn from those lessons. In the last few months, really beginning in the summer, the media has been very helpful in highlighting concerns about the lack of family presence within hospitals. And it was clinicians that we began to see here in a New York Times article where a critical care physician talked about a hospital without loved ones is slowly becoming our new normal, a reality that threatens to upend the role of family in the care of our hospital patients. This is a clinician saying and recognizing that they're not just visitors, they're holders of vital information and really need to be seen as part of the healthcare team. We were grounded in our beliefs that we could still adhere to public health standards and to reduce the risk of infection spread, but still practice in a patient and family-centered way. And we're thrilled with these colleagues who we have great respect for, published early in the summer in Intensive Care Medicine, the belief that infection control, public health concerns, and family-centered care can coexist. I hope that word coexist is something that you think about as you have more conversations within your organizations. Many of you know, and many of you have been our wonderful partners in the Better Together Partnering with Families campaign. We launched it in 2014. Deborah Dokken was the coordinator from the beginning, and we were so pleased to have a very robust partnership with Canada through the Canadian Foundation for Healthcare Improvement, which now has a new name. But we were focused in that campaign from the very beginning of changing the concept of families as, quote, visitors to families as partners, which means, you know, that visiting role does not capture the importance of the family's roles. Families are allies for quality and safety. They're holders of vital information about the patient. They're essential to safe transitions of care. And we have learned, particularly in the last year, they're great contributors to mental health and well-being for all. And I mean that sincerely. For all means to their loved ones, part of their family, but they are also important to the mental health and well-being of staff and clinicians and even leaders of healthcare organizations. What we're seeing is these disruptions in family relationship imposed by healthcare, hospitals and long-term care communities, government at the state level and at the provincial level, sometimes more at the community level, have really caused major disruption of family connections that are going to have lifelong implications. In this article published in 2020, they really talk about and label it as trauma, and that we're going to need to use a trauma-informed approach to care as we work with everyone going forward. That's patients and families, that's clinicians, staff, and leaders, and even people in the community as well. We learned a lot from families caring for babies in newborn intensive care about what it felt like. Many hospitals did say often only one parent at a time, which, I'm not sure the decisions that were made around pediatrics and newborn intensive care were really based on evidence, and that while they often permitted one person, if, would two people have made a difference? And the impact on the long-term outcome on these babies and children are important to consider. And certainly we know that social isolation is a risk factor, and it was so profound in long-term healthcare settings. And hearing from the residents themselves of that feeling of depression and the sense of aloneness, for older people, fragile people that really depend on that connection with families. I think the field is recognizing today, more so than they did a year ago, and I hope this builds momentum for us, learning from this wisely as we go forward, is that we've learned a lot about how to treat COVID, and we've learned a lot about how to prevent it with the amazing development of vaccines. But I'm not sure we're better able to address this collective trauma of COVID-19 and the separation from families. And if ever there were people that can help address this, I think they're on this call today. So we hope that you will share your stories, both of your process of change as you revisit family presence, but I hope as you use this tool that you'll share your stories with us. Now, to talk about this short guidance publication, Family Presence During a Pandemic, Guidance for Decision-Making. We don't give you the answers. We help summarize the evidence for you, and we help guide you in a process so you can make better decisions. But the overall purpose of this resource is through collaborative decision-making, we achieve a better balance of the benefits of family presence and participation and the harms and risks. So it's achieving that better balance at what this work is all about. In this, it's very succinct. You will have a copy in your handouts today. It's free, and you can download it and send it anywhere you want off of our website. We summarize very succinctly learnings about restrictions on family presence that we somewhat ignored in our experience with SARS and H1N1. Then we also summarize briefly the evidence and benefits of family presence. And the emerging evidence that we're seeing is that often it's not families that is causing the spread of infection. I feel like we went back 3 or 4 decades and blamed everything about infection on families. And really, a lot of it was coming through staff. We also discuss the core concepts of patient and family-centered care. And we also outlined the key um, principles of bioethics. And I'll mention those again in a second. So you all know on this call that everything we do is grounded in these PFCC core concepts. It's foundational to the operations and the way you do the work in healthcare organizations: dignity and respect, information sharing, participation, and collaboration. And those four core concepts really serve as a framework for decision making and to improve value, reliability, safety, quality, the experience of care, and even the work experience. And family presence and participation is just a key policy and practice that emanates from those core concepts. And then if you look at side by side the interconnectedness of the PFCC core concepts and these key ethical principles of autonomy or respect for persons, beneficence, which means to do good, non-maleficence, to avoid harm, and then justice. And certainly in this pandemic, we've learned so much about the tragic issues of health inequities. And again, by thinking about these ethical principles and the core concepts of patients and families, family-centered care, we can do a better job in decision-making going forward. So there are basically three key tools in the publication. There is a graphic that outlines a 10-step iterative collaborative decision-making process. There's a second tool that gives you questions to use in this process. And the third tool is a matrix to help you look at the balance between short and longer term harm for specific groups affected by change in family presence and participation policies and practice. So let's look at these tools real quickly. This is the 10-step process. You see the core concepts and the ethical principles right in the middle that should inform every step of the 10 steps. And the first, and I always think probably the most important, is to create a collaborative decision-making team. And I bet if most of you go back and look at the beginning of the pandemic, we didn't always have patient and family advisors and leaders at our sides from the very beginning when these policies were made. There were a few exceptions, but that's key. And we need to prepare them to participate at this high level of policy review and change or modification. And we need to have an ethicist part of this process. We need to have an infectious disease expert as part of this process. And we need to have frontline staff and clinicians part of the process. But this takes you through every one of the steps, including reassessing for context. That means what's happening to the pandemic. Do we have to remain in the restricted position that we are today? And that this wheel should be continually turning. The second tool takes this same wheel and gives you in each one of the 10 steps key questions to ask. I know people want us to give the answers, and we're looking to the field to help us give the answers. And those are the stories that we will share. But we do ask, I think if you ask the right questions, you use the matrix, I think you will begin to make the right decisions. And this is important that you share this tool with your leadership. So the third tool is an interactive matrix to balance these relative benefits and harms. So you'll be asked to rate them. Is this is the impact going to be very high, or is it not, it's moderate or very low? And the tool, you may not be able to see it, it enables the different groups that we hope are in the collaborative decision-making process to fill out. So clinicians have a column, other staff have a column, patients have a column, family and caregiver column, and the last is the community. And you can write in this, and it works like an Excel document. It's an interactive tool that will add up the highest impact. And so it'll give you a chance to look at visually what are the benefits and harms, and can we make better decisions? We also have a summary matrix. So if you write more than can appear in this, you have multiple pages, but if you want to see it in one area, it will summarize it for you as well. And so lastly, I wanted to share with you some additional tools, because many of you asked the question about that you wanted to overcome the barriers, you didn't know where to start. And we think this resource is a place that you can begin, and you can take the whole resource. But if you look at just the references, they are almost another tool in themselves. I know in talking to leaders, they often say, well, what's the evidence? Well, most of the resources were published in 2020 and 2021. So that's a tool for you to use. You have the next two, you'll have a new partnership, how we can partner more effectively with patient and family advisors during COVID. That's handed out to you today and on our website. And then the last resource is our COVID website. And I would stay tuned to that. Mary has so many pearls to share with you that we will be updating spotlights and more tools. And I thank you so much. I can't wait to hear the work you do. And Mary, I'm going to turn it back to you.
Great. Thank you so much, Bev. We are very excited about the tools that have been created, and we're really interested in receiving feedback from all of you that choose to utilize these tools in conversations with your larger community. We're going to shift gears right now. I reached out to organizations across the continuum who were doing great things over this last year in partnership with patients, residents, and families, and asked them to share with us some of their highlights, some of their lessons learned. And so I'm going to be, on behalf of them, sharing just a few of the things that they've learned and that they've done. And I was so blown away when they started sending me their information, because it was so rich, filled with ideas and examples. And I don't have time to do justice to every one of the slides. So what I've chosen to do is share all of the information with you and highlight a couple things in each of the slides so that we can show you a wide group of strategies for continuing partnership. So I wanted to start with MUSC Health, because their PFCC coordinator, Caroline, really summarized it very well. COVID changed everything for us, for patients, for residents, for families, and it was very unsettling. But one of the learnings that she shared was that moving to a virtual platform and encouraging and engaging her patient and family advisors across their organization was a lot easier than they expected it was going to be. They did a number of things during that time to engage patients and families, but I want to just highlight a couple things that I thought were very inventive. One is that they started providing weekly PFA office hours in addition to the PFAC meetings, just so that ongoing conversations could happen, people could touch base. It was a time of isolation, and so providing a virtual way for people to connect with each other was a way for information to flow back and forth. Because of what was happening across the larger community in terms of inequities and health disparities, it really put a spotlight on issues related to diversity and inclusion. So, and so they began a task force to really improve the diversity of their PFACs. And one of the things that is really a best practice that I was delighted to see that they were doing, even in the virtual room world, was that their PFAs were included in all interviews for new leaders, administrators, and above, which really sets the tone, even within a pandemic, that those partnerships with patients and families are so very important. So there were many lessons learned. I want to just share a couple of them with you. The opportunity to have influence with patient and family advisors in conversation to change policies quickly was really highlighted in some information that was shared. So there was a mother whose daughter had to have a COVID test because she was going to be having some surgery and a procedure. And because of the COVID restrictions, the mom wasn't able to go in while she was getting the test. And if any of you have had the COVID test, it's quite invasive and very scary. And here were these nurses who had to hold this child down to be able to do the COVID test wearing all the PPE. And it was just traumatic for everyone involved. Took a lot longer than one would wish. And by telling her story and having administrators there to listen to that story, they made a change in the policy immediately, because the parent had a suggestion that perhaps she could don the PPE, reduce the risk for a nurse, another healthcare worker, and calm her daughter at the same time. And so they made that change immediately overnight after hearing that story, because it was so powerful, and it really had people really question our assumptions about how we keep people safe and what's the best way to approach things. They had more accrued hours than ever with their PFAs by going virtual. And they also, in their diversity and inclusion, had the opportunity to hear a story from a Black woman who was receiving care from mostly white healthcare workers, and what that experience was like, and what were opportunities for improvement and to build trust across cultural and different experiences. And that became a story that became part of their virtual patient storyline. And so they really utilized the opportunity to look at what were the issues that were going on and really address them head on in partnership with patients and families. Patient advisors are often connected with organizations, but sometimes they're working in communities. And I wanted to share a couple examples of how patients from their perspective and their lived experience can really make a difference. So I'm going to share a story from Janice Tufte, who as a patient advisor had many opportunities, both because she reached out, but also because others reached out to her to make a difference. She was asked to present about the public patient perspective in working with vulnerable populations. And she was able to create a public health vulnerability framework that was shared during a webinar. You can see it on her website if you want to take a look at it. She was working with a research group with the University of Washington, thinking about together what were the research questions that were going to be important to ask and answer as we were moving quickly in terms of COVID and trying to understand it. And based on feedback from that group, including having a patient perspective, 57 projects were funded for study. And she, having lived as a homeless person, had lived experience. And so as they were beginning to think about how they were going to deal with safety issues with the homeless population in Seattle and King County, she was able to really influence how they looked at isolation and quarantine strategies, how they implemented efforts for testing and vaccine hesitancy. And there were a number of other national and international projects that she was able to participate on during this COVID time. She learned a lot of lessons, but one of the things that she wanted to really mention is that when no COVID patients were available to participate early on, it was important for advisors to be able to say yes to participating so that patient and family voice could be present. She also said that in a pandemic, it really levels the playing field when you invite all voices in, because everybody's learning as they go. And so it's a shared learning experience. And so she really recommended that we not be afraid when things are different than we've ever experienced them, to build on the partnerships that we've already created. And her insight and inspiration really is to understand that pandemics, although they're awful things, do create opportunity to build partnership. I wanted to share another article that was recently in the Wall Street Journal, because sometimes we need to be reminded that patients and families can be true leaders. And in a pandemic, we didn't know what we didn't know. And so the whole issue of the COVID long haul syndrome where people who even weren't hospitalized really had symptoms that went on and on for months, was not something that the medical community was aware of, and initially really said that really wasn't happening. And so COVID patients gathered together, and this is a great example of peer support, connecting remotely, and began to study what was going on. And so they did a rapid survey and they analyzed what was happening for 640 patients. But the interesting thing is that they got the attention of the medical community, and together they began to create a partnership so that there could be shared learning. And so never underestimate the power of patient leadership and the opportunity to really listen deeply for what are those lived experiences that we may not be aware of because it's ahead of what we know in the medical science community. As you know, nursing homes were hard hit and were continued to be hard hit during the pandemic. And so I wanted to be sure that we talked a little bit about some of the great things that were happening in the nursing homes. And so I went and we did a webinar on this. And so you can go and listen to more detail about this, but I want to highlight a couple things. Purim Living, which is a nursing home in Minnesota, their administrator really shared with me some advice that she had. She said that there was so much that couldn't be controlled, but their commitment to partnership with residents and families was really important. And so they really collaborated to determine what can be controlled when things are out of control. The other thing that they did is they began to think about family members as caregivers who could reduce some of the burden in the nursing home by coming in, being invited in a safe way to help do some caregiving for their family members. And so over and over, what she's really stressed, and you can hear more of it in the webinar, is the importance of seeking solutions together and not isolating one from another, because the power of that collaboration was really great. We talked a little bit about the whole issue of health inequities, and we were able to have Dr. DeWitt join us at that webinar related to nursing homes, and he represents the Maryland Aged Home, and it's one of the few small nursing homes that's had no deaths during this entire pandemic, and they serve primarily minority populations in Baltimore in the inner city. And some of his advice and some of his perspective and observations are kind of hard to hear, but he said that part of what he recognized early on was that for minority populations, often resources come late and don't provide what's needed. And so it's really important to plan for self-reliance and care. And so they were very strong at shutting down as soon as possible, purchasing their own supplies, really being self-reliant. But as they were doing that in order to save lives, they balanced that with responding with empathy to residents, families, and staff. They checked in about what was important to people, how they were doing. They looked for and increased their staff that did activities. They focused on the things that people really cared about, and they provided counseling to keep both the teams and the families emotionally healthy. And as we are moving, hopefully soon to be out of the pandemic, he shared some hopeful next steps that are happening. They have had vaccines administered. Vaccinated family members can now visit in private rooms. They arrange for and have outside visitation for those that haven't been vaccinated yet. They're continuing virtual connections because that is going to continue to be an option for some people, in addition to face-to-face visits, especially when there's some distance that has to be traveled. And they said to remember to rely on the science, and that was what really guided them. And I think that that's really important to remember. Our Canadian friends from Hotel de Grace in Windsor, Canada did some amazing things, and we highlighted them in a family presence webinar, but I want to share some things that were really important. Right away in March of last year, they involved their Patient and Family Advisory Council chair, who's a patient family member, to join their incident management response team, to really invite them into the fabric and the structure of what was guiding the kinds of decisions that were being made. And peer support is really important. And there's lots on this slide, but one of the things that they did is they provided the PFAC with an opportunity to do virtual visits for patients at their hospital. So it was an additional resource to reduce some of the burden and also provide support to patients and families. So these are really important things and strategies to think about. The other thing that they did is they only missed 2 meetings during COVID. They moved fast to get the virtual opportunities to interact and learn from each other up and running. One of the things that I think was amazing was that they created a designated care partner, and they used their PFAC members as they were creating this program to design the program and co-teach the orientation and participate in making changes. And basically what a designated care partner is somebody that's chosen and trusted by the patient, who is trained and can come in and be allies and active partners in care physically in the space. And if you take a look at some of the surveys that they did, 99% felt confident and prepared to act as a designated care partner, and 99% felt like they understood their roles and responsibilities. And they have a number of active partners now, and they are continuing to expand that program so that they really are building that partnership. In terms of their lessons learned, I really want to focus on momentum. And the important question that they asked is they were thinking about what they were going to create in their environment and what kinds of decisions they were going to make. It's often when we're fearful and in a pandemic or an unknown situation to close down and think about what we need to stop. However, what they did, and I love their questioning, was they stopped and they started asking the question, how might we, based on their partnership, how might we address these issues that we're dealing with? And they have a real commitment to sustaining what they've developed, which is their patient and family leadership, their care partner program, and looking for additional ways that they can really continue to collaborate with patients and families. Beaumont Health did a number of things. They have a lot of patient and family advisory councils. But the 2 lessons learned that Kelly Parent shared with us is that staff need support during a time like this, that it is easy to just say no without stopping and really listening. And being able to have critical thinking skills and be able to be comfortable having crucial conversations with patients and families in this difficult time, staff really need support. And so they develop mechanisms to provide that support. And so one of the things that she really recommended is that we really think about how we support staff during times of crisis to maintain and continue partnerships and be open to saying yes and not just saying no. And the other thing she said is virtual PFACs are not to be feared. And she listed all the different ways that their PFACs contributed, ways that were really instrumental and integral to the work that they were doing in their environment. I'm going to shift now to, ambulatory care or primary care. This is the Family Medicine PFAC in Cincinnati. And they actually have had a recent article published that we will send to you about how they created their PFACs in a virtual world quickly so that they could be able to respond to what was going on and have the voice of the patient there. But one of the patient advisors said, it's a great time to get a pulse of patients by utilizing your partners on the PFAC, because they can help lead the way to increasing communication and easing fears. And so there were a number of highlights that are in this article about televisits and how to adjust patient flow. But one of the things that they did to prepare people for the virtual world in a PFAC was to offer one-on-one meetings to coach and prepare and support people who maybe weren't as comfortable in the virtual environment. And what they noticed is that the patient attendance increased, and that maintaining that emotional connectivity is so important, so very important. So in Cincinnati, I want to just shift gears a little. The Children's Hospital did some amazing things. We talked about how adolescents were feeling anxious, and that was a concern in a number of surveys. And so they developed lots of Q&As related to the pandemic, but they also, in partnership with adolescents, developed an app for adolescents on coping. And you know, adolescents are really into social media and connectivity and things. And this is a free app that you can download if you want to provide it to your to those that you have in your adolescent population. So it's a wonderful time. This last year has been a wonderful time for very creative and innovative approaches to be explored and created. In terms of other children's hospitals, at the intensive care nursery at Dartmouth Hitchcock, they did a number of things, and you can read those at your leisure. But the thing that I really appreciated is that they, as they were reflecting on bedside partnerships with patients, that they recognized that really strong leadership that was advocating for continued commitment to family-centered strategies was really important. And they actually created policies so that two parents could be at the bedside. And it was a real unwavering commitment. And they continued conversations using telehealth. And so you'll hear that throughout these slides, at how important telehealth became. And in terms of their partnerships, being able to integrate people into leadership in a variety of settings was important. Also, the thing that they talked about was how important their council was to facilitate messages of hope and thanks from the community to staff. And we talked a lot about how that can really mitigate the isolation that healthcare staff are feeling. And I love that they talked about lots of documents were created in partnership with patients and families, and it really created and reduced the burden that the organizations were feeling, because the parents really took a lead in the development of some of those communication tools. So one additional organization that was doing amazing work was Children's Mercy in Kansas City, and they continue to do it in terms of their COVID partnerships. There are many, many great things to talk about related to them, but they transitioned 18 PFACs into a virtual platform, and they conducted focus groups to talk about and learn about recovery communication to assure that families knew when it was safe to return to care, because care was really important, and being able to not lose the opportunity to receive care can put kids at risk. I love that their PFAC created a training video for non-employee screeners so that they could really integrate and share the message of their commitment to patient and family-centered care and partnerships. They also supported their PFAs in accordance with state guidelines to really recognize the important role that they play in the healthcare arena, and they offered them COVID-19 vaccines and provided education, behavioral health education. So there are a number of things that they did, but the lessons learned are many, but I wanted to mention the whole issue of community town halls and utilizing those to provide critical information. When there was so much change in the pandemic, changing every day, almost every hour, being able to provide vehicles to create a communication robust system, they use their community town halls to do that. And the reality is that many organizations thought PFAs aren't going to want to, we're really busy, PFAs aren't going to want to be involved. And they really want to highlight that one of their lessons learned were that PFAs wanted to remain engaged in their advisory roles. They wanted to make a difference. They wanted to reduce burden. Michigan Medicine has a huge number of patient and family advisors, and they continued and strengthened their partnerships with patients and families. They created their patient and family members, reviewed patient education materials, and helped co-develop a COVID caregiver book that was available for new families and patients who had COVID. And they used patients and families who had experienced COVID and had gotten through the worst of it to inform that caregiver book, and it's available on their website. They also, advisors initiated a project and followed through and did all the work related to it, because what they started sharing was when people are all, you know, in their PPE, you can barely see their eyes, you can't see their face. It's very intimidating. So they started what they called a button project, where all staff frontline caregivers got their picture taken with a smile, and they put it on a button, a big button that could be on the outside of their uniform and their materials so that people could see their faces. And what I loved about that is that they did not only did they have the idea, but they did the work. One of their lessons learned was everything that advisors were involved in helped them do or respond to things in a better way. That the one lesson learned was she felt like they'd taken too much time off with their PFAC before they reinstituted it after 2 months, and said, in hindsight, I wouldn't have stopped it at all, or it would have been a very short pause. University of Rochester Medical Center has obviously a lot of PFACs, and you can see just the diversity there. They had a number of partnership highlights during COVID, but I think the important thing that they were trying to communicate here is that the listening, understanding, collaborating, and influencing was powerful with their patient and family advisors across all of their patient and family advisory council sites. One of the things that they realized is that outpatients and patient and family advisors help them develop and refine conducting group therapy over Zoom. And as a result of that involvement, they continued to increase the ability to effectively provide group therapy over Zoom and meet the needs of patients and families. I want to give you a couple highlights from their Deaf Advisory Council, because the deaf individuals in this council really took a leadership role in talking about the impact of masks and how best to communicate with deaf people while wearing the mask. And they created all kinds of curriculum around that. And so these are some of the suggestions and recommendations that people who have the lived experience were sharing with the University of Rochester. And so they established new policies and procedures, and talked about what works well and what not to do. But the thing I thought was most amazing was that they worked with their deaf population to create a COVID-19 symptom screening tool so that it didn't require as much communication, or if communication orally was confusing, that the use of pictures and simple language in a very health literate way help them be able to do symptom screening with people who had hearing loss. Something that they wouldn't have thought to do had the advisory council not been involved. So I wanted to kind of wrap up, to share with you another example of an organization that supports academic medical centers across the country, and that's Vizient. And they right away, having strong partnerships with their academic medical centers, but also in terms of working with patient and family advisors and advisory councils, really understood the importance of having the patient and family voice involved. And as the academic medical centers in May were thinking about reestablishing surgeries and other services that had been kind of shut down during the height and surge of the pandemic, Vizient really looked across the areas across the country to conduct a variety of focus groups in starting in May, but in an ongoing way, and created a number of surveys. They call them short pulse surveys. And so they were doing these surveys from May through January of this year about how people can safely access healthcare and what were important considerations from the patient and family perspective. And so they, patients and families were really helpful in helping create a number of recommendations about processes and settings and what's important to families, that we really need to understand what an individual's personal risk analysis is, because that really drives the kinds of decisions that patients are going to make, and that we have to remember that technology will continue to be our friend during this time. But ultimately, the most important thing that they learned in these surveys, and that was reinforced, is that doctor-patient communication and relationships matter, and we need to build on those relationships in a way that really assists people in being able to feel comfortable and respected in the decisions that they make about whether to get care at this time or to delay care. And also in terms of the relationship, so that people can understand what the benefits and risks are for the decisions that they're making, and to understand better what are the factors that affect the decisions that people make related to this particular issue. And in your email, in addition to the slides, you will get a copy of this survey so that you can read, obviously, a little more information about it, so that it can help inform you as you're thinking about maintaining those relationships and building back stronger and better. Well, I want to just take a moment to really thank the partners that really responded to my request to share what their experiences were. And these are individuals that have maintained and strengthened their commitment to partnerships and have really looked for ways to build on those relationships. It is very difficult in a pandemic, and we need to understand that we did the best that we could, and that we will continue to learn and grow. But when we can learn and grow together, I think it really creates a more diverse opportunity and way to look at things, but it also creates and strengthens those relationships that are what build a strong patient and family-centered care situation. I wanted to take a minute to let you know that there are additional materials both at our IPFCC website and through our learning community, which is a free learning community that we call PFCC Connect. And it's a way that you can connect with other people in your network across the continuum, ask questions, share information, and learn from each other. So if you are not a PFCC Connect member, we encourage you to go to the link that's provided and join the learning community, because we will continue, not just with COVID, but in all aspects of PFCC, we will continue to create an opportunity to connect with each other and learn together. We have created a place on our website for best practices, and some of the people that we've highlighted today we've created spotlights through interviews with more information. We also have a number of helpful resources that are available. And so we really recommend that you go out there if you want to read more about it and learn more. So we are completing the New York State Health Foundation project, but we are still committed to supporting PFCC practice and strategies during this time, because COVID, although it's hopeful with the vaccine, isn't going away in the near future. And our next informal conversation is going to be Tuesday, April 6th, which is where do we go from here? And as we think about where do we go from here, in our informal conversations, unlike a webinar, we do not drive what is shared. The people who join the informal conversation really identify what are the important issues and questions that they want to discuss together and learn together. And one of the things that came up in the information that you sent during your registration was, what if our PFAC hasn't been meeting? How do I re-energize our PFAC? How do we reconnect? And so that may be something that you want to discuss with your colleagues, and where do you go from here is a great opportunity and venue in order to do that. There are a number of strategies and ideas that people are learning about out in the larger PFCC community, and being able to share challenges and strategies together is what these informal conversations are about. So we want to, in this next informal conversation, talk about what is important to you, what is it we can support each other in doing. As I reflect on this last year, it seems like it's been forever. And then in some ways, it seems like it's been in the blink of an eye. So much change, so many things that have challenged us. But as I reflected on the information shared by our colleagues, what I noticed was that it's all about where we put our focus. And when I looked at the great ideas and strategies that they've shared, the challenges that they've addressed and faced together in partnership with their patients and families, I'm reminded that when it rains, we have to look for rainbows. And when it's dark, we have to look for stars. And I believe that the contributors of the information that we have on this website are really the rainbows and the stars. And I really appreciate them sharing the information that they shared. And I really want to acknowledge those of you that have joined this call and are interested in maintaining and continuing and strengthening partnerships with patients and families. It's really important. And I want to thank you for joining us. There is an evaluation on this webinar, and we really want to continue to improve our services to you to support you in advancing patient and family-centered care in your learning. And so please take the time to fill out the survey and help us understand how we can improve. Now, because we aren't having a big Q&A at this point, if you haven't had a chance, please do send in your questions through the chat. If you have additional questions, please reach out to me by emailing me. I will, if the questions are one about things that some of the partners that I shared about today, shared in a broad slide, and I don't have the level of detail, I will try to get that information for you and share it broadly. And I'll do it not just with the individual who asks the question, but I'm going to create kind of a document of Q&A and responses that will be shared on our website with the webinar recording, so that everybody can learn from the great questions that people ask and be able to go to another level of detail. So I really thank you for being here. I know that we have like 3 minutes, and I'm not sure, Marie, if there are any burning questions out there that have been received that maybe we could respond to.
Mary, I think your webinar very much answered many of the questions. The one thing, there has been a request for the tool from around the deaf COVID resources. Okay. So, and I know it's not on the slides. So
I will contact my person at the University of Rochester, and I will get a copy, and it will be shared on where the link is for the website or the webinar on our website. That's an easy thing to do. So thank you for asking for it, and we'll get it to you. Anything else? Well, then I'm going to give you 2 minutes back of your time. Thank you so much for being here today, and you stay safe out there. Hope you'll be getting your vaccines soon if you haven't already. Take care.